Shelley, are we looking at PowerPoint slide deck?
Mhm. Yeah.
Yes, we are.
All right. There's several folks on my little SHIBA team here today. So folks, please help me with questions that come up in the chat, or if someone raises their hand and I miss it, and I'll see about um, run this slide deck a little bit. So by way of introduction, if we haven't met, I'm Tim Smolin. I'm your SHIBA program manager, and this is my contact information. I'm supposed to be recording the program. Maybe it's already recording. Is the program already being recorded? Callie, I can see your face on the screen. No way.
Yes, it is being
Yep.
recorded. Yes.
Thanks, Jerry. I promised some people aren't able to make the programs and they want to hear them. So I promised we would record the program. So let me advise you that the program is being recorded. So bear that in mind when you share your commentary for the transcript. Um, Again, this is my contact information, and it's a sincere offer to please reach out if I can be helpful with anything that's going on with you, or if you want to share an idea or suggestion, or um, in the Midwest, we say something is stuck in your craw and you want to work it out, then send me a note or give me a call. And I organized these kind of quarterly town hall meetings when I started because I felt like then, and I still feel like now, we're going through a lot of changes in our team and in our network and among our volunteers, and of course, with the Medicare program, government relationships. I wanted to have some continuity of relationship with you all and to create an opportunity for us to have some dialogue together. And most important, just for me to thank you personally for everything that you do every day so that you could hear directly from me on behalf of the commissioner that we really appreciate the work that you're doing, and it really makes a difference. So I always look forward to these meetings and a chance to see you again. I don't get to see you as much as I wish and check in. So that's kind of what's behind the meetings. As usual, I'm going to have a kind of prepared presentation and then hopefully have ample time for questions and answers. But please feel free to stop me anytime with a question. I'll try to sort of self-regulate and stop myself periodically to make space for you. And yeah, I'm looking forward to the conversation today. So by way of today's program, I'm going to give you some updates from our perspective in Olympia about what we're doing in support of you guys and kind of what's on the near horizon. It's going to be another busy year, lots of changes for us. And then we'll, as I say, have some times for unstructured questions and answers. So by way of updates, we'll talk about the hiring we've recently done and the hiring that's coming next. Talk about volunteer recruitment efforts for the first and second quarters. I think that's going well. As I said, Susie is away this morning, so I'll represent her part of the program today. And then a quick update about the SMP project. And Kim is on vacation, so I'll cover her part of the SMP project. We'll talk very briefly about supplemental long-term care insurance. And then, as I was saying to my friend Diane there at the break, we'll talk about enhanced outreach contracts a little bit. So just to give you a sense of some of the things we're working on. And then before the discussion, I have some charts and graphs to share with you about kind of our caseload, the caseload in the rearview mirror, caseload forecast. Okay, so with that, let's start with staff updates. We have several new people in our team, very excited. Jasmine and Lily are here this morning. Luis lives and works in Zillah, Washington, out Yakima County, and Leani will be starting with us on the 16th. So Jasmine and Lily, shall we have you introduce yourselves, please?
Sure, thank you. Good morning, everyone. My name is Jasmine Pablo. I am the new project coordinator for the SHIBA program. I am going on my fourth week now, and I will be supporting major SHIBA projects and doing some project management and organization for the SHIBA team. Prior to this role, I actually worked on the general hotline with OIC, so I made plenty of SHIBA referrals, and I am very excited about joining the program. Um, Two major projects I'll be working on where I might get the opportunity to work with you is the enhanced outreach contracts and the the supplemental long-term care insurance training and consumer's guide. And Tim will go over those more later. And then previous to the hotline, I worked in local government and consulting, mostly doing diversity, equity, inclusion work. And before that, I worked for a behavioral health clinic for Cowlitz Indian Tribe. So, yeah, I'm super excited to be here.
Thank you. Nice to have you. Welcome back. And Lily, do you want to say hello, introduce yourself?
Sure. I'm Lily Nelson. I'm in my second week actually here, so I'm even a little bit more newer than Jasmine is. I am the training coordinator and curriculum specialist for SHIBA. And according to my supervisor, Kendra, who I'm sure many of you know, she's going to have me working all kinds of different projects and things like that. So I'm looking forward to all the wonderful things I can help do with Medicare and with SHIBA and with all of you. Thank you.
Thank you. Thanks. Good to see you both. Thanks for being here again. And then next up on the near horizon, now that the legislature has finished and the governor has signed the budget, we were very fortunate that we had legislative support and support from the commissioner to add 6 more people to our SHIBA team, and they'll be working in the role of Medicare specialists. So as Jasmine said, they'll effectively be that first point of contact for callers to 1-800-562-6900. They'll work live chat, they'll manage email, they'll manage forms that come from our website, they'll make referrals out to you all as the sponsor organizations and volunteers. So historically, we have hired non-permanent staff to do seasonal work around open enrollment because that's obviously our surge of work. And so it's sort of a business reality that that's always going to be the case. And as some of you said, the call volume hasn't really. It used to be much more seasonal or cyclical, but now it's much higher year round, which is a good outcome. So this is just recognizing the fact that we need some more additional staff support. So in the last session we had 6. In the session before that we had 6. In the next section, I'm working on my next request for 6 more. We're going to continue just to try to grow our SHIBA staff team around your needs and the needs for beneficiaries that we help directly and supporting you all who are our contractors. So that's what's on the horizon. Please, you always do, but please make people feel welcome. And we're looking forward to bring people out to meet you when you have your events and things in the summer. So if you're having summer barbecue volunteer recognition event, please invite us. We'd love to be invited. Speaking for myself, I love barbecue. So how about volunteer recruitment? In the first quarter, we did a combined direct mail campaign and radio campaign. We were mostly focused on counties where we have new sponsor organizations. So that would be Timber River Connections in Lewis County, the Whatcom Council on Aging in Bellingham, Whatcom County, and then Catholic Charities, which is our sponsor organization for Southeast Washington. So sort of how this works is that we buy a mailing list and we're mailing to households with residents age 60 to 70, combined household income less than $200,000. And you can see we shipped about 200,000 pieces of mail in the first quarter, and starting next week, we'll be shipping about 260,000 pieces of mail to most of the rest of Washington counties and sponsor organizations. So a couple of innovations with the mailing this time. We're explicitly identifying our community partners. So these are in alphabetical order. So Aging and Adult Services, Area Agency on Aging and Disability Services, Southwest Washington. That's our friend Pam Manahan. And then Action Health Partners, that's Central Washington. Aging and Long-Term Care, that's your group out there in Spokane. So each of those pieces of mail then identifies the local sponsor organization and their contact as well. So we feel like that's a better way of kind of representing the partnership, which is obviously very important to us. I would say that so far it's going very well. I'll have some data for you on the next slide. So we had about 300 people who expressed interest in potentially being a volunteer. Our protocol then is that those get sent on to the volunteer coordinators to schedule sort of an orientation screening interview, make sure that that person is likely to be a good prospective volunteer. If we get mutual agreement at that place, then they come back to us, and Susie Tegman, who is our organizational coordinator, orders a criminal background check for them, enrolls them into privacy training. Um, Almost no one doesn't pass the background check. Most people complete the privacy training on time, and then we enroll them into our basic training course. At this point, you can see we've had 10 people have cycled through the entire process and completed basic training. So we feel really good about this for first quarter activity, and we're looking forward to the second quarter activity. Lots of innovations. I wish Susie were here to take credit for it, but we lots of innovations intended to improve accountability and provide more support for the volunteer coordinators. So if any of you who are volunteer coordinators on the call and you have experience from the first quarter, or even volunteers that are in those areas that you want to share with us, I'll make a minute to do that. But the feedback overall has been very positive. It feels like a good handoff back and forth. And because of this big demand, we actually added an extra basic training course. So we'll have 2 programs in May because we don't want people to wait too long to get started. So I'd say all things considered, good first quarter campaign, and we're excited about the second quarter campaign. And let me stop there and ask for questions or comments.
I wanted to add one quick comment on that one. The beginning of May, the early May basic training program is completely full, which is wonderful news. It also means that we're already filling the end of May program. And we are planning on doing 2 programs in June as well. And then we'll probably continue that for a while based on the need. So great job, everybody, getting these new volunteers in. It's pretty impressive.
Yeah, thank you, Kendra. And, of course, from my perspective, I think people who have long-term longevity, and that's many of you on the call, obviously, the main event is immediately helping a consumer in person, on the phone, out at a health fair, virtually, using Zoom or Teams. But I think also a lot of it is that you find that you're in a community of people that you enjoy spending time with, and you have a positive relationship with your volunteer coordinator. So I just feel like that sort of social experience of being a volunteer is very important, and something that we're really committed to, and we feel great about our partners who are volunteer coordinators, or like Diane, work in the AAAs and provide that social emotional support as well as technical support. So I just want to acknowledge that the work of current volunteers to make new volunteers feel welcome is equally important as anything that we're doing on the technical training side of the equation. So thank you for that. Okay, so here's a quick review about the Senior Medicare Patrol Project, or SMP. The Senior Medicare Patrol is one of 3 federal grant fund sources that we have. We've been doing this for more than a decade now, and it's going very well. And as I said, I'll have some data for you in a few minutes to show you kind of the relative increase in the caseload related to this. It's not clear to me how much of that is that there's more fraud per se in the world, compared to there's just greater awareness of our program as a resource for people. And I think that's, again, a good positive outcome. But this is meant to just be a refresher, or for folks that are new, an introduction. So the Senior Medicare Patrol is part of our SHIBA program in Washington State, and its mission is about prevent, detect, and report fraud in the Medicare program. Fraud is real. It does happen, and a lot of times people who are victims of fraud experience a lot of shame and guilt. So the reporting is probably way underreported. But we do have a good positive relationship with local, meaning Washington State, and federal partners, including in law enforcement. So we do make referrals when there's instances of suspected fraud, and we can help people differentiate what really is fraud from what might not be fraud but can still be very worrisome or feel threatening. And of course, a lot of the work of our volunteer coordinators and volunteers is just about raising awareness, helping people do things they can do to protect themselves, and again, holding us out as a resource for them. The focus of our activities right now is around Medicare Fraud Prevention Month, which we do annually in June. So Donna Wells and Kim McKenna are working very hard on standing up all of our kind of outreach, education, paid media, social media to promote the reality that we can help people who are concerned about fraud or have questions about what might be fraud. So for those of you who are volunteer coordinators, or I know my friend Don Berg is here, and Don does a lot of public presentations. Scott Opsel from Bellingham does a lot of public presentations. Many of you are going to be out there doing health fairs and other kinds of exhibitions. So June will be sort of a concentrated push for us to raise awareness. We'll have some new materials that we're creating, and we're updating some materials and translating some more. So kind of a lot of activity kind of concentrated right around June time period. And then here's Kim's contact information if you haven't already been introduced to her. Besides doing this outreach and casework, Kim also helps support the training work that Kendra's team does. So she's contributing to the monthly CE programs, to the basic training programs, to the Lunch and Learn programs. So if you have feedback about training specifically about SMP, then will you please send that over to Kim. As Jasmine said, we are looking forward to the advent of supplemental long-term care insurance in Washington. I'm recycling this slide from the January town hall program. So in Washington State, which is a Washington unique initiative, we have this thing called the WACARES Fund. So people like me who are working are contributing a small tax to fund future needs for long-term services and supports. So that's the WACARES Fund. Supplemental long-term care insurance will be policies sold by private insurance companies that will pay after a person exhausts their WACARES Fund benefit. The WACARES Fund will start paying benefits in Washington State on July 1st. So I expect that we will see these products in the market the last part of this year and the first part of next year. And I think that they will be more popular. We're going to see more in my kind of crystal ball. We'll see more activity related to these than we have for traditional long-term care insurance, because I think the premiums are going to be more affordable, because there's that provision where first you spend down your WACARES fund and then you are eligible to use your private long-term care insurance. In my mind, it kind of works like in general how your insurance premium is going to be lower if you have a high deductible. So because the WACARES fund will pay first, I think that the premiums will be relatively lower for these products. And I also just think that there is a much greater awareness in the community about the reality of long-term care. People generally prefer to stay in their homes as long as they can. And both the WACARES fund and these supplemental long-term care insurance policies will pay for home-based care, including providing payments for family members to be paid caregivers. So I think the policies are really adapting to the reality of people's preferences and how the economy of caregiving works. And these are the reasons why I think there will be a relatively robust market for these policies. The other reason that I think there will be is, kind of the ecosystem for agents and brokers. A lot of them have had reduced incomes and reduced opportunities for sales, including things like Medicare Advantage plans. We had lots of conversations about that across the last Medicare open enrollment period. And so I think there are a lot of agents and brokers who see this as an opportunity to both, improve their income and develop some specialized skills and help people in their community with an important product. So these are the reasons why I think that there's going to be a relatively robust market for this product. I think it's a unique opportunity for the Insurance Commissioner's Office to, again, kind of hold ourselves out as the full service consumer protection agency so that we're kind of helping people guard against getting manipulated or exploited or buying policies that don't make sense for them or misunderstanding the policies or not knowing how to compare the policies. So we will be producing a consumer's guide to supplemental long-term care insurance, and we will be creating some training curriculum around these products. We'll start with our audience being the staff who work here at the OIC, but then we'll look towards training those of you who work in the community, either at agencies like Diane's or true volunteers who are interested in counseling about this or delivering this training to each other, kind of peer-to-peer. So timeline for this is like Leani will start next week on Thursday. I have a draft of an outline for the consumer's guide. I've got a meeting next week with our public affairs team about converting that to some web-based content. So hopefully, I'm thinking we'll have that consumer's guide done before the end of the summer, and maybe about the same timeline ahead of open enrollment for a training module about supplemental long-term care insurance. So let me just stop there and ask for questions about supplemental long-term care insurance, plans for Medicare Fraud Prevention Week, before I launch into enhanced outreach contracts.
Tim, I have a question.
Mm-hmm.
This is Diane. So as I understand it, the Walk Cares Fund is only useful for anyone born 1968 or later. So how is that going to work with if they say, oh, you must use that before the long-term care insurance? For those who are elderly, really elderly, right? Who really might need long-term care insurance, how's that going to work out?
It's a great question. Monday was my birthday. I was 63, so I was born before 1968. So thank you for calling me young elderly compared to elderly. I appreciate that. Yes. So let me just take a second here. So the way the Walk Cares the way the Walk Cares Fund works, in order to sort of cash your benefit, there's two criteria. So one is that you have to have been contributing to the Walk Cares Fund for 5 years to qualify for a full benefit. And the other is that you qualify based on a functional needs assessment. So you have a demonstrated need for long-term services and supports, which is about needing significant help to do several of the activities of daily living, right? Bathing, dressing, toileting, transferring. And so, yes, so for someone like me, when July 1st comes around, I will not have been paying into the Walk Cares Fund for a full 5 years. I could qualify for a reduced benefit. And so I would be eligible to use a reduced benefit in the Walk Cares Fund and then a supplemental long-term care insurance policy. But the policies really are not for 63-year-olds, they're really for 33-year-olds. And the thinking there being that you would sort of buy the policy in 2026, but then you might use it, in 20 years after you're fully vested and you have a need for long-term services and supports. So it's a bit of a stretch for us as the SHIBA program, because really sort of the target demographic for these policies is younger people. But I think the connection is that we work with, including your organization, Marky and Ed are here from Olympic Area Agency on Aging. We work with a lot of professionals in aging, long-term services and supports, home-based care services. So I think what we're going to get is lots of inquiries from people who are elderly using long-term services and supports, as well as their family and caregivers. So I see that being kind of the nexus where we're going to be it's going to be that sort of light bulb moment, right, where younger people are helping, and not necessarily older people, right? Like lots of younger people can also experience disabling conditions, short term or long term. But it's going to be the thing that kind of raises people's awareness, right? That gosh, maybe I should invest in one of these policies so later in life, or when a bad thing happens, and maybe I have an accident. I have a good friend who went over the handlebars of his bicycle. Thank heaven he was wearing a helmet, but he had a traumatic brain injury and had a need to step away from his work and be cared for several months in his home by a skilled professional. So we tend to think of it as being a condition of aging, but um, it can also affect younger people. And so I think what we're hoping, Diane, is that just because we have these relationships we work in, aging and disability community, that will be a resource for younger people that really are the market for these policies. Am I answering your question? 1968 is in the bill because we just are starting to collect premiums a couple of years ago. So as of July 1st, most of us will not be fully vested. Give me some feedback, Diane. Am I on point for your question?
Yeah, so maybe others know the answer to this question, but so I'm sorry, it keeps saying I have an unstable internet connection, so I'm sorry if you can't hear me very well, but so the long-term care in supplemental insurance policy is something that's been developed by the state. It's not a
No,
I guess I always am skeptical, to tell you the truth, of long-term care insurance in general.
you should be skeptical. Yes, I mean, I think that's a good posture in general for someone buying an insurance product, right? Be skeptical. But I would say that what I'm calling like traditional long-term care insurance policies, I think that industry is having real financial challenges in terms of solvency. And those policies really, a lot of them were much more restrictive in terms of the kinds of care that they would pay for. So a lot of them really were not a good value. Um, on the other hand, some people did buy those policies and use them and had a great experience. I think that there's some maturity in the market, and I think these will be better policies that more reflect kind of contemporary reality of care settings and caregivers. And I think that the premiums will be more affordable, and I think there's some better wisdom in terms of underwriting at the company level and regulation by agencies like mine. So I'm for sure not saying that you should set aside your skepticism. I think we should be very skeptical about these products. I think we should make sure that people are not taken advantage of, right? That these are kind of scary, emotional topics, and money can always be difficult for people to talk about. So I think what I'm saying is when these products come on market, we want people to maybe not dismiss them out of hand, but to engage, to have do some self-reflection about whether it's a good idea for them, and if it is, be kind of a thoughtful consumer about choosing one. And then if there's a problem, that they know that we're their resource in terms of complaints. So the WACARES fund is a public benefit, and then the supplemental long-term care insurance policies are going to be sold by private companies to people in Washington state that have the WACARES benefit.
Okay, and one last question. I bet a lot of people will be asking SHIBA volunteers about WA Cares. So has there been very much education about WA Cares for SHIBA?
No, there hasn't. And I think you're right. I think that's going to happen. So what we're going to do is arrange for my friends from so WACARES Fund is part of the Department of Social and Health Services. So these are state employed people that work for the Department of Social and Health Services. And they're going to come to our town hall meeting in July and do a presentation specifically about how the WACARES Fund works. And between now and then, they have had for several years now, an ongoing series of public programs, webinars, community outreach. And so it's time, my judgment, it's time now for us all to learn more about WA Cares, because I think that's exactly what's going to happen, Diane. People are going to come to the SHIBA volunteers, right? I mean, I'll just say, my friend Jerry has her hand raised. So Jerry lives and works up in King County, and she's going to have a counseling program with somebody about, say, open enrollment and Medicare Advantage. And in the course of the conversation, they're going to have this awareness like, wow, gosh, now I realize that Medicare is not going to pay for my long-term care services except in very narrow space, right? Skilled nursing facility care. And then they're going to say, well, gosh, Jerry, what am I supposed to do if I need long-term care services? And then Jerry will say, well, it's not a Medicare covered service. So probably you're talking about your personal savings, or potentially you could qualify for Medicaid. And then they're going to say, well, what about this WA Cares fund that I keep hearing about? And then Jerry's going to have to provide, kind of spontaneously in the moment, some kind of response to that, which is going to be more like, well, you've retired 10 years ago, and so you didn't contribute to the WA Cares fund, so you're not eligible, but let me explain to you how it works, because, we just want to raise awareness in general. But you might want to talk to your son, daughter, grandson, granddaughter about it, right? So it's about thinking about how do we kind of enable the SHIBA volunteers to be a good resource, but it's probably more like a referral. Having said that, I'm also, very open to the idea, and I do not mean Jerry personally, but that Jerry might just say, like, I want to educate people about long-term care insurance and supplemental long-term care insurance, and I like working with younger people. Give me some materials to get out there in the community and do some presentations. I'm completely open to SHIBA volunteers doing that kind of work. I always describe this as like creative tension, right? Because it's not, no one's getting hurt feelings about this. But how, and I'll figure out how to send you all the citation for the law. But the law that passed out of this bill, in my reading, it says the OIC will create a consumer's guide to supplemental long-term care insurance and use the SHIBA program to educate people about these products. And so we had some good conversations inside my organization, because from the beginning, going way back to the beginning, 1990, when we had the advent of the SHIP programs, it was part of the portfolio for our programs to counsel about long-term care insurance. We hardly ever do it for exactly the reason that you said, Diane, but it's always been understood that there's an expectation that the SHIBA program and the SHIBA volunteers counsel beneficiaries about long-term care insurance. So the legislature, in my reading, really intended for the SHIBA program and the SHIBA volunteers to counsel about supplemental long-term care insurance. So when the bill came around, like I say, we had this good conversation, and we negotiated our way into one person for the SHIBA program, and that's the Leani, who's coming next week. I initially asked for more staff support because I feel like it's a unique opportunity for us, and we should do more of this, and we should use SHIBA volunteers, and it's a kind of a cool opportunity to diversify our network of SHIBA volunteers, that we can have middle-aged people like me and Jerry work with younger people, but we could also recruit a bunch of younger people who want to be SHIBA volunteers and work with other younger people about long-term care insurance. That idea, I didn't kind of win the argument about that one, but I live to argue another day. So I see this as kind of being our year one initiative. And as I say, as the conditions in the market evolve, I'm very open to us thinking more expansively about what kinds of work can SHIBA volunteers do with long-term care insurance and supplemental long-term care insurance. So that's a long answer. Goodness. Jerry, what do you have for us?
I was working with a client who was going back to work. He's 72 years old. We got him out of his Part B, but he now realizes that his employer is taking money out for long-term care. But he has a long-term policy that he bought when he was 50 years old, and he's still paying into his private long-term care. Can he opt out of the Washington State
Yes.
long-term care? How
Yes.
how does he do that?
If you send me a note, I will help you help that person to opt out.
Okay, great.
But
Thank you.
you're welcome. Yes, there is a provision in, so now we're still talking about WACARES compared to supplemental long-term care insurance policies. But yes, folks who have a private long-term, I'm calling it a traditional long-term care insurance policy, can be exempted from contributing payroll taxes to the WACARES fund.
Thank you.
And this was like litigated for a number of years, but people who initially opted out can have a second chance to opt in again if they so choose.
Okay, good to hear.
Some of that too. So send me a note and I will follow up with you.
Okay, thank you.
You're welcome. So yes, Diane, thanks for the questions. And I think there is a need for us to do some kind of broad-based education for the SHIBA network about WACARES funds, supplemental long-term care insurance, and then kind of based on the level of interest that you all have and kind of the what happens when WACARES starts paying benefits July 1st and when some companies come into the market and we license some agents to sell these policies, then we may have a further conversation about training for you all to do more than just referrals, but actually do some counseling. And then there's this imaginary space in between where I would love for you to be out in the community doing some presentations. Hey, Bill, what do you have for us?
On these supplemental policies, is there any idea as to what the premiums would be at this point in time, or is that still being negotiated through the OIC?
It's a great question. So far we have not had any companies file policies or rates or forms. So I don't have a good idea about what those rates are going to look like. Yeah, I guess I'll stop there, Bill. I guess I won't stop there. I guess I'll say that as a general observation, I think they're going to be relatively more affordable than traditional long-term care insurance policies. And there are some provisions in the law that are designed to help kind of mitigate long-term, the escalation of premiums over time so people are able to hold on to them. But at this point, I don't have a good idea about like a good quality policy might cost about this much for a 30, 40-year-old person. We won't know that till we have some companies file proposed plans, and we haven't seen that yet. But I think it's going to come in the summer, fall.
And will the supplemental policies basically cover the same items that the Washington Care Fund covers? So other than, it sounds like they cover home care. I don't know how much they cover for things like adult family homes or those sorts of things. Will that be part of what will be in the supplemental?
Yes. So I think that's one of the kind of relatively good outcomes about this is that the coverage really will be aligned to WACARE. So essentially, like if to use your example, Bill, if services for certain support for activities of daily living are covered under the WACARES fund for something like adult family home, then they're required to be covered by these private policies. So there is going to be this kind of congruence in terms of benefits.
And if that's the case, obviously the premiums will not be that low. I was extremely fortunate that I could afford long-term care insurance, which I got for my wife which I have had to use now for the last over a year, and it's been very, very, very beneficial. And they cover quite a bit.
Yeah, when the policies work, I mean, they're great policies. I have personal experience. A dear friend of mine, she had the good fortune that she was working in the federal government a number of years ago when they offered it as a benefit to federal employees, including for their family members. So because she was a federal employee, her parents both were able to get long-term care insurance policy, right? And it was a group policy, so it was a better policy than an individual policy. And both her mom and dad both used that policy and had years and years of care paid for. So it was a very, very good value for them. Yeah. So, I mean, I think, as I said about Diane's question, I think some skepticism is in order, and there are a lot of good success stories out there. And the premiums can be very expensive. And some of that is about when you buy it and the features. But to answer your specific question, yes, it'll be required that essentially the same level of care that's a covered benefit in WACARES be a covered benefit for your supplemental long-term care insurance policy. Yeah.
Thank you.
Thank you. How about other questions before I kind of pivot to enhanced outreach contracts? Enhanced outreach contract is kind of our term of art for a contract that we do both with SHIBA sponsored organizations and with organizations like Diane's that we refer to as Area Agency on Aging or Aging and Disability Resource Centers. And the intention, well, this is the language on the screen is the language from our federal grant with the Administration on Community Living. And then the next slide is going to be about what we're trying to include in our contract language. So because, and we're very grateful for the federal funding, but the federal funding has been relatively flat now for many years. And, the reality is that the cost for our contractors is not flat. And we need more contractors because we need to reach more people. So we have now for a couple of years supplemented the federal funds with state funds. So as we look ahead to October, which will be the starting time for these contracts, we're going to be about 50-50 federal and state funds. Another one of those inside the building negotiations, right, between me and the commissioner. But she's been strongly supportive of this. And the funding is expressly intended for what we call enhanced outreach. And enhanced outreach means making an extra effort to reach people that historically have not been well served by state government, federal government programs like ours. So we're talking about rural, disabled, low income, English as a second language, Native American, Alaska Indian, and just generally people homeless, right? Folks that are generally going to have a more difficult time getting support from us for whatever reason. Application assistance means low income subsidy for Medicare Part D. It means the Medicare savings programs. Increased access to benefits and services means all the things that we've been talking about, as well as things like using the walkconnection.org application to get people enrolled into medical, housing, transportation, right, food benefits. So it's meant to supplement or build on the the great work that the SHIBA sponsors are already doing and our community partners at the area agencies on aging and aging and disability resource centers are doing. For those of you who've been around for a while, historically we called these MIPA contracts because the federal funding comes out of this unfortunately named bill called the Medicare Improvements for Patients and Providers Act 2008, MIPA. So you may have heard us call these like MIPA contracts. I'm trying to see us kind of migrate to calling them enhanced outreach contracts because we're not just using federal funding and we're not just looking at federal performance measures. We're really wanting to create local plans that meet the needs of local people and for us to fully fund those as much as we can. So across the summer, then we will be having conversations with you. This will be you with your volunteer coordinators and your regional training consultants working on a contract that makes sense for the space that you work in. So today's the day that I'm picking on my friend Diane Tribble from out Central Washington. So we're going to say, hey, Diane, we're thinking about Grant County. We're thinking about Adams County, Chelan, Douglas. Like, what are the needs in that community that the area agency is focused on in your service plan, right? Your area plan and your plan to collaborate with local tribes, including the Colville, the Yakima. How can we work together with you to fund outreach, education, application assistance, and kind of partner you up with Action Health Partners, Rural Resources in that space so that we, as a program, have an effective presence. So that's really what this conversation is about, and we're looking towards an October 1 start date. This is a lot about borrowing the credibility and the relationships that organizations already have, especially organizations that work with people who don't have English as a first language. So we're really focused on language and ethnic service providers, where we're kind of borrowing the trust and credibility of those organizations. So short-term goal, improve our services, diversify the population of people that we're helping, and then long-term goal, of course, diversify our network of volunteer advisors. So that's what's kind of between now and the end of September, and on that short list of projects that Jasmine has. So quick review, kind of try to connect the dots here a little bit. So at a high level, kind of for the SHIBA program, 4 broad goals that relate to volunteers, marketing, data, and casework. So enough diverse, proficient volunteers and a system to perpetuate that network over time, an effective marketing approach so that people know that we're here to help them, a systematic approach to collecting and presenting data and evidence, and compelling stories, and that we're able to handle complex cases, including fraud. So last in January, I had kind of a picture for you of a inverted pyramid. So here's the alternative view of the inverted pyramid, where at the highest level we have about 1.6 million Medicare beneficiaries. We currently have about 200 volunteer advisors. We have 30 community partners. We're growing our staff team towards 30 people, and we're trying to then optimize the funding support we get from the federal government and from the state. And all of this, of course, rests upon the reputation of the program so that we can earn the funds that we need to support our partners in the community and our team and you, so that we can take care of Medicare beneficiaries. So as the total number of Medicare beneficiaries grows and their needs become more complex, right, we just have to kind of build that foundational support for that upside down pyramid. So that's kind of what we're aiming for. Here's a view of where we're currently at. These are the data from STARS, again, alphabetical order by partner organization. We're just about 200 active volunteers. You can see kind of the distribution of them across the network. My goal in my conversations with the commissioner is that we're going to grow to 600 volunteers statewide across the next couple of biennial budget cycles. As I said, I think very successful outreach campaign here for Q1, Q2, and we're moving those folks, into basic training, and then ideally sort of solve them being helpful as much as we can for the open enrollment period in October. With regard to so let's call that one like enough volunteers. On the question of proficient volunteers, this is my hand-drawn picture. What we're trying to do at a high level here is convert a motivated layperson into a proficient volunteer advisor through this thing that I call Path to Certification. And what that looks like is we have some instructor-led coursework And this is the space that Lily will be working in, as she said at the top of the program. So this is basic training, CE programs, lunch and learn programs, new counselor training, and other kinds of programs that we organize to help support you all. And of course, there's lots of self-study by you all. You're all very diligent about keeping up yourselves. And then on this dimension, then we have peer coaching and mentoring, and many of you are doing that kind of work all the time now, and thank you for that. And the thing that connects those two things, of course, is these structured training modules. So if I think about like a module for supplemental long-term care insurance, Medicare Advantage, Medicare Part D, enrollment, eligibility. So it's about creating sort of this catalog of modules that can be facilitated by instructors, and this space also includes our online learning platform Canvas that we contract with Washington State University, and then those same learning objectives, those same skills-based outcomes show up then in peer coaching and mentoring, so that we end up with volunteers who are certified in the sense that we can vouch for them doing quality work out in the community. And I'll just say this same general model applies to staff training, but my focus, of course, is on certifying volunteer advisors. And then, as I promised you some data and graphs, I'm going to talk about our homegrown at the OIC case management system called ORCA. ORCA is how we manage casework related to complaints and fraud. And so here's our total of ORCA cases that are worked by SHIBA staff over the past couple of years. And I drew in the trend line so you can see where we're going. And my forecast, of course, is that it's going to continue on that trajectory. And then the next slide is about specifically cases that we tagged as being about suspected fraud, or the presentation from the Medicare beneficiary was suspected fraud. And you can see that from Q1 of 2024 to Q1 of 2026, we've gone from kind of 10 to 110. And again, I think that's more about awareness than it is about the prevalence of fraud. But I think that awareness and the fact that people are reaching out to us is a good outcome. And I think that we will continue, as I said, with things like Medicare Fraud Prevention Week, we'll continue to promote reaching out to us as one way that you can help get some support. So the meaning of this is that we need to get some more staff support in our team and some more support from you guys. As I said, in this session, we got 6 Medicare specialists that will be helping us with the Medicare open enrollment. In the previous session, we got 6 staff people in various roles. So that would be Ari, Tamara, Lily, working on curricular materials and training support, and then Jasmine to help us with some project coordination, data management work, and then Anita and Callie to work on casework. So as we work on enough diverse, proficient volunteers, that's that team. And as I said, we're working on kind of a surge of recruiting here in the first part of the year. With regard to marketing, that postcard mailer obviously is expressly about recruiting volunteers, but it's also intended to help just raise awareness about the SHIBA program and our sponsors. We talked a bit about community outreach in the form of enhanced outreach contracts and our partners. And of course, the work that you all do in the community all of the time, doing things like public presentations, senior day in the park, other kinds of exhibitions. So just promoting awareness of the SHIBA program, and we need to obviously keep working on that. And then with regard to casework, it's just going to keep growing. We're at 50% of people now are enrolled in Medicare Advantage plans. For those of you who've been around a little while, you've seen in successive years this big churn that happens when plans exit the market, reduce benefits, raise premiums, and that's all, again, crystal ball, that's all going to continue into this fall. And these are relatively complex roles. So we're talking about DME, hospice, ambulance. a lot of complex cases. And so we have to both recruit people into our group so they can work with you and also then work on cross training and succession planning in our team. So that's the formal presentation that I have for today. So maybe let's have some time to hear from you all about how things are going from your perspective and where we might be more helpful or where we might be getting in your way or anything you want to share with us. Let's start with you.
Uh, well, I was very happy to hear that you, Tim, mentioned people for whom English is a second language, because this is a huge layer of population where people have a lot of misconceptions about Medicare. And it started with me personally, my family, my friends, because I don't know when there was a change in legislation, but when I checked first, like years ago, maybe 15 years ago, I was assured that green card holders were not eligible for Medicare.
Mm.
So there was that time. I never went back to that problem. And but I know that now I know that things changed. And what I know for sure that green card holders, like 99% of them, do not know that they are eligible. And their family members, let's say I married an American guy. He knows that back then I was not eligible as a green card holder. And now I tell him that I am eligible. And he says, you are engaging in Medicare fraud. So family members of those English as a second language residents, they do not know either. So there is a lot of work to be done. And in this environment, when everybody is looking for fraud, to make sure that people do not suffer for these accusations just because nobody knows exactly what's going on, it is a huge problem. And I am not digging into other problems because there are lots of problems with the people with this group of population who now are eligible. And there are a lot of nuances how they are eligible. Some are completely eligible, some, and the reasons why their eligibility is differs. So I think that there should be something separate here where we need to pay attention to educating this group group of population in the frame of enhanced outreach or something else, because there are lots of people who need help and they are afraid to ask for help. That's all.
Thank you. Thank you for that. So some people may not know you. Would you mind introduce yourself again and tell us where you're working, who you're working with, Ina?
I am with Spokane SHIBA. Nareen is my trainer. Well, she educated me. And I started volunteering a year ago.
Thank you. So Noreen is your trainer, and Noreen is with us this morning, and your local sponsor organization is the agents we call ALTQ, Aging and Long-Term Care Eastern Washington.
Yes.
Monica is your volunteer coordinator.
Yes.
So
Mhm.
I 100% agree with you about either people don't understand or they know the wrong thing about eligibility and enrollment and green card holders, right? Naturalized people or citizens. I think obviously you're talking about Ukrainian population, Russian population.
No, I'm talking about all
It's
population,
all of them. Yes.
all English as a second language, because, well, by education, I'm a linguist, learning about languages. And what I know about those people is that all these, they do not have enough listening skills to understand spoken speech fully. So when they hear program on TV, on radio, they kind of they do not pay enough attention, or they do not understand it fully. So we think that we broadcast everything and everybody should be aware, but people just do not recognize the information that is aimed at them. So there are lots of reasons why there are lots of problems with the green card holders. I'm talking about green card holders in the first place.
Okay. Yeah. So I think first I would say, we have a lot of humility about this. We don't believe that just because we put something on the air or distributed something that necessarily we made a connection with people. So I think for me, that's why individual volunteers working with individual clients really is the right solution, right? And an average appointment time for us now is 50 minutes because it takes that long and lots of multiple appointments with people. So I think what you're raising, though, is a good example of the kind of thing that we, as the program, we just need to do more of. And it's the kind of activity, it's very creative, it's very important that we want to support through these enhanced outreach contracts, right? So we're essentially asking for you to work with Monica, to work with Noreen, and say, in Spokane, what could be done about this? What is the opportunity to do a better job with green card holders to help them understand what the rules about Medicare are, and if they're eligible, how to get enrolled, right? And potentially, if they're late enrolling, how to manage around late enrollment penalties, right? Or qualify for the kind of Medicare savings program that would waive the penalties. So I think it's a I appreciate you bringing it, Ina, because I think it's a good example of the kind of idea that we want to support, and we want to you're going to have better ideas about how to make that happen in Spokane than I will, right? And we need you then to help support Noreen and Monica to kind of make it happen, right? Including creating the materials and the images and the text, the language, right? And how should it be delivered? Where should we take it to? Where are the folks that we need to reach? You'll have a much better you'll be closer to the community. You'll know which partners or how to organize around getting that material in front of people in the right way. As you said, the radio, the television, print, events. So thank you for raising that, because that's what ideally we're going to do across all the spaces that we work in. I would just say my friend Rebecca Ip is here, and she and I did a program last week with a group in Seattle where their focus is on folks from Southeast Asia, mostly China, and very similar kinds of concerns, right? About immigrants and asylees and refugees, and about people that go back and forth, right? They live here part-time, but they live in China part-time. So what, what if I'm living there when I turn 65? Or what if I got enrolled when I was here, but then I moved there for 2, 3, 4, 5 years, but then came back again? Or what if I brought my parents here and then, whether they're citizens or not, when would they be eligible for Medicare? And what does their insurance look like until they can get Medicare, right? So those conversations are the priority that we're trying to kind of highlight and lift up here. So thank you for that. Rebecca, do you
Thank
want
you.
to say anything here? No. Silent partner.
Yeah, I'm in the office. Hi, how are you?
Good. How are you?
Yeah, actually, I quite agree with, some of the issues that, as SHIBA volunteer and then we're facing, and then also, and then especially, and then we work with the ethnic group, and English is not the first language, and that is the secondary language, and then so I quite agree with Ina, and then all, the issue, and then we encounter when we are assisting those clients and then which English is not their first language, because Medicare is not easy to understand. Okay, it is very, very actually, even though we work as a volunteer, but I'm sure we are professional volunteer. We're just not a casual volunteer. And then for those kind, like in those center, and then just helping, and then for some partying, and we are really carrying on then a mission, and then to help non-English speaking group minorities or underserved community, and then to serve. And we have to be more patient when we work with the clients, because we have to stand from their own standpoint instead of ours professional language. And we have to, just what I say is to just carry out the message in the layman terms. That is difficult, but not to disturb the original. So just to be a SHIBA volunteer, just like, and then to explain to immigrant and then of different country, different culture, and about to let them know about the healthcare system and then in America, and also and then the operation that in reality there is a big discrepancy, and then in what they think, and then in what they assuming, and then okay, the government should provide all the healthcare system to us, and that is nothing taken for granted. And we have to, help those our immigrant, asylee, refugees, and then sometimes, and then to understand, and then what the reality is, and then how to adjust, and how to make them comfortable. Like Tim just mentioned, yes, it will be very difficult for us to explain, and then to some of our clients who want to immigrate their parents, their elderly parents to the United States, and in which they don't have any working history, and then maybe they don't even have any, backgrounds here, and then just to how to get them into the healthcare, the Medicare, and without, sometimes and facing, the very expensive premiums. But that is not usually not the case, and then we feel a lot of difficulties in serving those kinds of late immigrants come in their late 60s, 70s, 80s, because when they first land, at least they have to wait for 5 years, and then before they are eligible, and then to enter into Medicare, even though age-wise they are old enough, but for residents, the 5-year bar, they still have to wait. So we have to explain to them. And in the in between the gap, and then especially we know nowadays that we lost a advanced premium tax credits in the ACA healthcare system, the Washington Health and Finder, and so this group of people almost and then fell into, a big gap, a big hole in which they don't entitled to many or none of the government subsidization and for their health care. So especially this year, it happened this year. Okay, last year they're still okay, but not this year. So we need a lot of patience and then to help, and also as volunteer, and then we have to update and learn, the different policy. ourselves. Last year, I would say the last enrollment is a tough one because not only facing the enrollment, but also we have to catch up with the, day-to-day changes of, policy, whether this is Medicare, Medicaid, or Washington Health and Finder. Yeah, so I hope this year may be better, but it sounds not quite like about it because I anticipate after June and then there is another changes about benefit Medicaid, things like that, and then still happening. Yeah. But still, and then we're glad, and then we have the SHIBA and our Tim's office as a great support for us. Yeah, and all our trainer, our regional trainer. Yeah, thank you.
Thank you, Rebecca. And for people that haven't met Rebecca, Rebecca is our colleague at Chinese Information Service Center in the CID in Seattle. So good to see you, Rebecca. Bill, what do you have for us?
A couple of things. First, we received a referral from a 211 agency, which is the first one that I can remember in the many, many years I've done this. And I was just wondering how much the SHIBA program coordinates with the training program with the 211 folks.
Great question. Not enough. I would say it's a bit stronger in Central Washington because our sponsor out there, Action Health Partners, they have a very close relationship with the 211 system. But around the state, I'd say it's a weak connection. We're aware of each other, but we could certainly do more, Bill.
Thank you. I think the 211 folks don't have a clue as to how the program actually started prior to 211 as an effort by the folks at Employment Security, Department of Corrections, and Family Policy Council to take care of folks who had completed their sentence and were now out in the community. And this was put together by the folks at Airways out there in the Spokane area. And it was an amazing program at the start. The second thing I have is I have a question about how much SHIBA coordinates with the folks at Healthcare Authority and Department of Retirements as far as their webinars, because we keep running across, I don't know how many state employees who call us and say, oh, tell me about Medicare. I'm retiring at the end of the month. And it is amazing. They have absolutely no clue. And the folks at Healthcare Authority have spent hours putting together web pages with all sorts of very, very comprehensive information. And I was just wondering how much of a coordination they do with you folks.
Well, we're better on that score, Bill. We do a lot of work with the Healthcare Authority, both on the PEB/SEB side and also on the Medicaid side. Good relationship with our friends at DRS. I just recorded a podcast with them a couple of weeks ago about high income earners and IRMA. And we got to do more. I mean, we had a very big presence, not last year, but the year before at the PEB benefits fairs out in the community. We started conversations with them about PEB benefits fairs means the work that the Healthcare Authority does ahead of open enrollment to kind of be out in the community. I mean, certainly we can do more. I feel like we're doing a lot, but we're still missing just lots and lots of people. So many more opportunities that we haven't realized. I do a program tonight for the Lake Washington School District retirees. We'll get 30 people, and it is remarkable that folks. It's like what you said. They're like right at the brink of retirement, or they're starting, 2 years ahead of time when everything will change by the time they get there. We have very few people kind of in that middle space, but I did a program with DRS. I'm trying to remember end of last year, and I think we had 300 people in the audience, online. So I think compared to 211, we're doing much better with HCA, DRS, but still lots of room to grow, and absolutely open to ideas, Bill, from you and Kelly and the folks at Senior Services.
Well, I have been to the employee health fair, their big open enrollment thing that they run out at LNI, and there aren't many people who actually stop and talk to us. It's amazing. Other than they want to grab a pencil, or a pen. Other
Yes.
than that, they really don't want to talk to us, and they really ought to. And
100%.
as you said, the Healthcare Authority has built a guide to retirement, and it talks about the 13-month process of retiring. And it's a little too early on most of it, but it would really help if people would actually start to get involved a little bit earlier.
Yeah, I agree with you. I think I'm having lunch with those guys next week on Thursday, or this week on Thursday, to talk about planning for the next open enrollment cycle. But for sure, for all of you, because I know lots of you get calls from state, school district employees, other businesses, super open to ideas and suggestions, please. Hey, Scott, good morning.
Good morning. Say, the website was revised, what, maybe a year and a half ago?
Yep.
Um, I didn't find it was an improvement for people looking for, information on Medicare. I was just wondering how your staff has found the usefulness of that as they've dealt with folks.
That's a great question. Does anybody who works here want to talk about their experiences?
It often seems like it's not ordered in a way that would make sense to people who are not really didn't know what they were looking for, but needed to find information.
Sure.
I look at how things are sequenced and I said, well, that really shouldn't be there. It really belongs further down, and the most important things need to be at the top. And actually, it was a lot easier for people to go to the website and find information about Medicare on the old website than it is in the current website.
Okay. Well, certainly. When you and I talk about kind of like restructuring our website improvement, a lot of that is kind of the technology behind the scenes. So kind of the interface, right? But in terms of the content and moving things around, we have a lot of latitude about that. So Scott, if you have specific suggestions, we'll absolutely take those, because that's very easy to make those kinds of changes. I can't make structural changes, but in terms of the content and kind of shifting things around, we have a lot of latitude about that.
Okay. I've talked to Shannon about it, and
Yeah.
we were going to get our heads together, and then, one thing led to another, and we're off on to dealing with other things.
Yeah. But, ahead of open enrollment obviously, that's like our peak traffic. We did have a kind of an open enrollment debrief about, looking at some analytics and which pages people go to and how they got there and where they went to after the page, how long they spent. We have a lot of analytics built into the website. We can kind of create a digest for you of kind of how it went last time. And then I'm meaning to speak to all of you on the call, and please take this back. We absolutely want your feedback. That website is a tool for you and your consumers, and you're the closest to it. So please let us know, and we can change it. Within, like I say, kind of structurally, but we can change the content to suit your needs.
Good. Thank you, Tim.
Yeah, thank you. Thanks, Scott. How about other questions or comments, suggestions? I want to say hello to my friend Tammy Wheeler from Tacoma. Tammy was one of those folks, when I put the data up there, we did a lot of mailing in Pierce County and Tacoma. And Tammy, everything I hear from Rosie and Susie is that you did a great job with meeting prospective volunteers and helping them get started. So thank you. Also, Kelsey is here. Kelsey, I don't know if you were on when I put up the mailing data, radio data for first quarter. You've had a very busy time out there in Yakima, Walla Walla, Tri-Cities, and everything I hear from Ari is that you guys are doing great. Thanks for being here.
Thank you. Yeah, that was an amazing campaign. We've had a really great response. So.
Mm-hmm. And Maiken, you might be our newest volunteer coordinator up working with Scott in Bellingham. There you are. Good morning. You were also kind of the early early adopters of the male radio campaign. How's it going for you?
It was good. I was curious about what the responses were going to be like, and there was like a little rush, and then kind of a lull, and then another rush. It kind of comes and goes. I don't know how people are coordinating their timing, but it's good. We have I would say volunteer recruitment season is the busy season for the volunteer coordinators. It's kind of like our open enrollment, I guess. So, but it's been good. I've had really good conversations with people. And I just want to commend everyone that's here who is already an advisor. A lot of people that I'm speaking to that are interested in becoming a volunteer, it's because they had an experience with a SHIBA volunteer and or their mom did or their friend did, and it's really it's a tribute to I guess a credit to everyone's care and their information to say, hey, I had such a great experience, or my person that I know had a great experience. I want to do that too. So thanks for everyone for all your time that you put into this, and your learning and your patience and your listening and your information, because you are contagious and you're making more people want to come and do this crazy retirement plan. So thanks,
Thank you.
everyone.
Yeah, good to see you. Hi, Ed. How are you? You're on mute there, my friend. Ed is representing for Olympic Area Aging, SCRIM, PA, PT, right?
Yeah, doing great. We're pretty
Forks.
busy. Can you hear me?
Forks, yes,
Forks,
sir.
yeah, Forks as
Let me
well
not forget Susie.
with Susie up there. Yeah, we're doing great. It's getting a little busy. We are getting actually, even though it hasn't hit our side yet in terms of the mailing, we are getting interest already from about I think 4 or 5 volunteers so far. So we have some of them in the chute, so to speak.
That's great.
Yeah, so it's going good.
Good, good,
Exciting.
good. Yeah, nice to see you. Thanks for coming out today.
I'm seeing.
I haven't seen you in a little time. I think last time I saw you was when you had volunteer appreciation event out there.
That's right. That's right.
It's good to see you. Thanks for coming. And I saw Murky was on for a little while earlier.
Yes, it was.
Okay, friends, we're kind of winding down here. Other things that you want to check in about before we ring off? I'm not going to put my slides back up there because I'm not very good at it, but I do have one more slide that just says, again, appreciating you for your great work. I know that it's hard. I mean, right, there's no question that it's hard work, and my expression for this is it may not be life-saving work, but it certainly is life-changing work. And I know that you all have great stories that are an inspiration to all of us who don't get to see you and work with you as much as we wish. But please know from us that we see you and we see the work that you're doing, and we're aware of the impact. And when I had the slide about reputation, and to Miken's commentary, it is all about that great experience that you give people and perpetuating that down the line, because a lot of people are skeptical and have had bad experiences of working with government, and so they're reluctant to make that first call. But when they call and they get a volunteer advisor, you bring so much relief to them, and just let go of a lot of stress and anxiety and help kind of make sense out of complex things for them. And so I just want to appreciate you. I really, it's a privilege and an honor to work with you, and I'm inspired by your example to be a better person. So thank you for everything you do. And please keep in touch. Barbecue, invite me out to visit you. Good to see you.
Thank you, Tim.
Martha, say hello to your sister for me.
Thank you.
Okay. Bye.
Thanks, Tim.